Good morning, guys.
Morning.
You guys, any questions yet?
No.
No? Okay.
No.
Okay. Everything goes fine? Okay, guys. Let's see if we can start. Okay, guys. So the other day we finished off with in the middle of the body cavity. So we can mean yes, okay, just briefly. So we had cavities, which were the posterior cavity, which was just the spinal cavity, and the cranial cavity. And so what we're going to do today is we can say it's okay, talk about the interior cavity, where we already know that, or we briefly mentioned that, okay, yes, the interior cavity was broken down into two subcavities. Right, okay. One was going to be as okay, what we will call the thoracic cavity, where we mainly said that, okay, yes, the word thoracic, this was okay pertaining to, and okay, yes, from the thorax, the term was thorax, which just become, yes, okay, where the X is just replaced by a C as we put it. When we just, okay, put this suffix after it. We also said that, okay, as the other cavity was, okay, sorry, the abdominal pelvic cavity. Right, okay, which we further go, yes, okay, subdivide into, yes, okay, the abdominal cavity, and okay, yes, into the pelvic cavity. Where guys, okay, yes, abdominal is mainly, yes, okay, just pertaining to abdomen. And likewise, you can say it's okay, pelvic. No, the ick is me is okay, pertaining to. And okay, here the structure is pelvis. Okay. Now, guys, before we go into talking about is okay, each of these two cavities here, let's just make clear that okay, there actually is going to be as okay a physical separation between as okay the thoracic cavity and abdominal pelvic cavity. So these two cavities are actually separated from one another by a muscular sheet. So that actually is as a muscular sheet that is going to separate the thoracic cavity from the abdominal pelvic cavity. Mainly so that structures from the abdominal pelvic cavity doesn't float up into the thoracic cavity. Or likewise, it's probably not going to happen, but it's okay that structures from the thoracic cavity didn't sink down into the abdominal cavity. And this muscular sheet or muscular separation that separates the thoracic cavity from the abdominal pelvic cavity, that is called the diaphragm. Okay. As from diaphragm, we can go and say it's diaphragmatic. Now, guys, at a later time, what you will do is, you will come across, as a term that is going to be phrenic. Phrenic. Where, as the word here, phrenic, is again, just pertaining to. And where the word phren here is mainly another term for your diaphragm. Is that clear? Okay. So probably towards the end of what we want to call it, anatomy physiology. You will come across the word phrenic, which mainly is going to be related to the diaphragm. Yeah, okay. But this diaphragm here is it is a muscular sheet. And what I mean is, it does it separates the structure from the thoracic cavity, or separate the thoracic cavity from the abdominal pelvic cavity. Is that clear?
Yes. Yes.
Good. Now, what we will have in the diaphragm, and you will actually see why. We will actually have, we can say it's 3 openings. Right. Why? Mainly because there are some structures in the thoracic cavity that is need to continue with structures in the abdominal cavity. Clear? Okay. So one of these is going to, as we can say, is mainly the leftmost. The leftmost that is going to is what we call the foramen hiatus. Okay, and what passes through this structure is we will briefly mention that in a little bit. The next one is going to be what we'll call the aortic hiatus. Some people call it the aortic hiatus. Some people call it the aortic foramen. And the last but not And okay, yes, what is going to, yes, okay, be the rightmost is going to be called the aval hiatus. Okay. So these are mainly as okay going to be as okay, we can say it's okay, 3 openings in the, or as okay, foldways or gateways in the diaphragm through which, as okay, structures will continue from the thoracic cavity to the abdominal cavity, from the thoracic cavity to the abdominal cavity, or from the abdominal cavity into the thoracic cavity. But beside that is okay, from right to left, from front to back, that's okay. The diaphragm, the thoracic cavity and your abdominal cavity are separated by this muscular sheet called the diaphragm. Did you guys get that?
Yes.
Yes.
Okay. Now, at this point here, does anybody have any questions?
Nope.
Now, let us just start off with just, okay, the thoracic cavity. Now, right, the thoracic cavity, yes, okay, if we talk about, yes, okay, its boundary walls. The boundary of the thoracic cavity is going to be formed of ribs. Okay, guys. Now we mainly have, okay, as a total of 24 ribs, which are distributed into 12 pairs, which mainly means that you have 12 ribs on one side of the thoracic cavity, 12 ribs on the other side. So that becomes, okay, 12 pairs. First rib, second rib, third rib, fourth rib, or first pair, second pair, third pair, fourth pair, so on, so on, so on. Okay, which is 12 ribs, which makes up, or 12 pairs, sorry, which make up a total of 24 ribs. Now at the back, it's okay, these are attached onto vertebra. Or we can actually say, okay, see, vertebrae, because it's okay, it's going to be a total of 12 vertebrae. So from each vertebra or backbone, is there going to be, okay, a rib from there that goes around the right side and a rib that goes along the left side, which makes up 12 vertebrae. Now these vertebrae here, is okay, they're going to be, okay, be called the thoracic vertebrae. Is that clear?
Yes.
Good. Last but not the least, okay, the ribs are, yes, okay, going to be, yes, okay, attached in the front, yes, okay, what we commonly can call it, okay, let me just, I probably need to write something here. It's going to be, yes, okay, the chest bone. Yeah, okay. Where we can mainly say, yes, okay, that the ornate, yes, okay, the term used for the chest bone it is called the sternum. Okay. So the term for your chest bone is going to be sternum. Okay, where we can, yes, okay, say from sternum, yes, okay, is going to be, yes, okay, sternum, just pertaining to. Like, yes, okay, for vertebra is going to be vertebral. Now, guys, the word costa, no, sorry, rib, that is what you call it in English. The technical term for the ribs is going to be costa. So you can say one costae or multiple costae, two costae, three costae. But the technical term for rib is going to be costa. Did you guys get that?
Yes.
Yes.
Okay. Now, guys, okay, as something that's going to be as okay, we can say is okay, anatomically important. We can put it this way and say it's okay, we have a rib above. Let's say this is the rib. And okay, lower to that is going to be as okay, another rib. Clear? Now, guys, in between the ribs, in between the ribs is going to be as okay, a space. Now, please keep in mind, guys, this is going to be as okay, a rib above and a rib below. Okay, yes, okay, and we can say okay, on the same side. Okay, but what we actually have is okay, yes, in between, yes, okay, two ribs where there's a rib above and a rib below, is there going to be as okay, this space here. And this is mainly as okay, what we'll call the inter. As I said the other day, that okay, the word inter meant in between. Right, okay. From costa is going to be costal and then space. Okay, so the space between a rib above and a rib below, we can say, okay, a rib above and okay, yes, a rib below, a rib above and okay, yes, a rib below. These spaces here are going to be called the intercostal spaces. Did you guys get that? But if you look at it, that's okay, the way that it is broken up, it means that's okay, just means space in between the ribs. Clear? Did you guys get that?
Yes.
Yeah.
Okay. Okay. And what we have in these intercostal spaces here is okay. You may feel them on yourself. It means that's okay, they're going to be as okay. As okay, some muscles. Okay, later on, as okay, in A&P, we'll talk a little bit about these muscles, but these are mainly as okay, going to be a muscle that helps us breathing. That's okay, as one of the reasons that they are there. Okay, so they actually is okay, are going to a muscle that helps us in breathing, but we can mainly as okay, just refer to them as the internal, the intercostal muscles. Okay, and then we have the external intercostal muscles, the internal intercostal muscles. But right, we also can just call it intercostal muscle because they fill up the intercostal space. Clear? Likewise, guys. Now, not just only in the thoracic vertebrae, But it's okay when we said, okay, yes, vertebra, you may have a vertebra above. And you may have, okay, as a vertebra below. Now again, yes, okay, in between these two vertebrae here, it's okay, it's going to be, it's okay, a space. Okay. Which we say it's okay, will be, okay, it's okay. In between what? The vertebrae. So we can say, okay, okay, intervertebral space. Okay, but what we mainly as okay will find in this intervertebral space here is going to be as okay a disc of cartilage. Okay, so this disc in between, yes, okay, your two vertebrae is going to be called an intervertebral disc. Now, when you hear of something like, okay, it's a discus prolapse, this is the one that they're talking about. Okay, but it's okay, what the disc mainly is okay just is mainly is okay just a disc of cartilage. Okay, but why do we call it the intervertebral disc? Mainly because, okay, that is where it is located. In between, yes, okay, two discs. But we can say, it's okay, one is going to be a disc above and a disc below. Okay, between this disc and, okay, yes, okay, between this disc here and, okay, the disc below, sorry, the vertebral below, sorry, is going to be another intervertebral disc, and so on. Did you guys get that?
Yeah.
Yes.
So they're going to be as okay. Ribs, the word for ribs is going to be costa, or costae, if you talk about a river to more than one rib. How many ribs do we normally have? That's okay, they're going to be 12 pairs, or a total of 24 ribs. Okay. And the back is going to be as okay, your 12 vertebrae. Which vertebrae? Thoracic vertebrae. Why do we call them the thoracic vertebrae? Mainly because, okay, they are the vertebrae pertaining or is okay related to the thoracic cavity. And in the front, most of your ribs are going to, yes, okay, be directly or indirectly attached to, yes, okay, what we in common terms will call the chest bone. Where the technical term for that is going to be the sternum. The name of the bone is called sternum. Sternal is just going to, yes, okay, be pertaining to the sternum. Any questions? Any questions, guys?
No.
No.
Okay, let's see. Now, guys, if we just say it's okay, the thoracic cavity, like this. And what we mean is okay, at the bottom was going to be it's okay, the diaphragm, okay, and below that was going to be it's okay, your it's okay, abdomen. Let's just move this over a little bit. Oh, it's going to be checking up motion. So we can just draw, okay, it's a small thoracic cavity over here. And of course, it's okay, we have the diaphragm. Now, guys, your thoracic cavity is going to be, yes, okay, we can say, further subdivided into, yes, okay, one paired cavity, which actually is okay, will make a total of two. And that's going to be, yes, okay, one paired cavity.
What does that say in the first and the red?
Paired.
Okay, sorry.
Right, okay. So, and okay, guys, when anything comes in pairs, it's going to be two, right? Just think of, okay, as if you go and buy as, okay, a pair of socks, you would expect to get two socks, right? In each pair. Right?
Yeah.
Good. So that's okay. One cavity is going to be paired, which means that's okay, you will have two. And one is going to be, it's okay, unpaired, which means it's okay, it means since it is unpaired, it's just going to be one. Now, guys, when we talk about, it's okay, the two pair cavities, it's going to, it's okay, be pretty much similar. There's going to be a right and a left. And the right and the left cavities of the thoracic cavity is going to be these, which we mainly as okay, we'll just call it okay, the pleural cavities. Now, guys, what we mainly as okay have in the right and left cavities, or right and left pleural cavity is going to be consist okay, the right lung, and okay, yes, the left lung. Is that clear?
Yeah.
Okay. Now comes the question is, okay, why do we call it a pleural cavity? Now, guys, the word plural, because, okay, plural is mainly, okay, just pertaining to plural. Okay, so plural will mean it's, okay, just be pertaining to the plural. Pleura. Clear? So what in the blue is this plural? Now, guys, just like we talked about the brain and spinal causality and say it's okay, it was caught up in a sheet called the meninges. Likewise, is it that okay, it's your right and left lung. Your right and left lung is going to be covered up by a sheet, which means it's okay, just call it plural. Here. Okay. Now, if you look at the pleura, for instance, this is going to just okay be made up of two layers. Where we mainly can say, okay, we will have okay as the outer layer, and we will have okay as an inner layer of the pleura. Now, as far as the outer layer is concerned, guys, that is going to be called the Now you can say it's okay, either the parietal layer or the parietal pleura. Okay. Whereas, okay, as the innermost layer of your pleura is going to be called the visceral layer or visceral pleura. Okay. Now, here again, yes, okay, the L just again, yes, okay, just me pertaining to. And okay, now the term or the word viscera actually is okay, is a technical word for what we will call organ. So the mainly is okay, just called the visceral layer or the visceral layer. In this case, is okay, the visceral pleura, because of the pleura. Okay. Because that was going to be as okay, the layer of your pleura that actually is okay is going to be closest to the lung. So if you look at it in this way, you can say, okay, the outermost layer, that would be just okay, your parietal pleura. Then we have okay as the visceral layer. Or we can say, okay, the visceral pleura. And then, yes, okay, pretty much, okay, just deeper to that, what's going to be, yes, okay, your lung. Did you guys get that?
Yes.
Good. Okay. Okay, yellow is probably the wrong color to choose. But anyways, okay, good. Now, guys, just make that, okay, as wherever you have, yes, okay, two membranes. Or else, okay, XYZ number of membranes against one another. Okay. And especially as okay, if those membranes, okay, may be moving, you will have a fluid. So pretty much, okay, as in between, yes, okay, the two layers of your pleura. Because we can mean it as okay, that these two fellows here, or these two layers here, they actually is okay made what we call is okay the pleura, or we can call it the pleural membrane. Right, okay. But in the space in between is okay, the parietal pleura and visceral pleura was going to be as okay a fluid. But here it's okay, the name of this fluid here is pretty much straightforward, not as we had in our meninges, where we end up calling it a cerebrospinal fluid. Here it is just named after the name of the membrane. So it's just going to be called the pleural fluid. Did you guys get that?
Yes.
Yes.
So that's when that's okay, or makes a coccopie is okay, the right pleural space and the left pleural space. Okay. Which can mean is as okay will be as okay the pleural membranes, and within the pleural membranes is going to be as okay the lungs. Okay, the two layers of the pleural membrane was respectively yes okay, outer is parietal layer, and the inner one is the visceral layer. Where I mean yes okay, told you that okay the visceral layer mean yes okay, L is again yes okay, our favorite yes okay pertaining to where the word viscera. It's mainly as okay, just a fancy word that actually means organ. So whenever you come across the word visceral, it's just going to be as okay, pertaining to organ. Did that make sense?
Yeah.
Okay. Any questions?
No.
Good. Okay. So this was mainly as okay, you were pleural cavity. Okay, now in the right pleural cavity is going to be the right lung, and the left pleural cavity is going to be the left lung. Now, guys, this single cavity or subcavity of the thoracic cavity, there's only going to be one. There's no right, there's no left. There's no anterior, no posterior. Okay. This single unpaired cavity here is going to be as okay, mainly as okay, where we just have in between as okay, the two pleural cavities. So if I can write it down here, guys, okay, you can say it's okay. The space in between is okay, the pleural cavities. And that is going to be called the, now we can call it the, or can be referred to as the mediastinal cavity. Again, that's okay, the word or the suffix. Okay. L here still is okay, our favorite, pertaining to. So it's going to be as okay, the name, or just so you can also call it the mediastinum. And if you just look at the word media, it's okay, mainly it's okay. So if it's self-explanatory, because the word media itself is okay, means middle. Is that clear?
Yeah.
Okay. So, okay, how to just okay, define what the mediastinal cavity is mainly as okay, just the space in between the two pleural cavities, or in between is okay, the two lungs. Right, okay. That space between the two lungs, or between is okay, your right and left pleural cavities is going to be as okay, the mediastinal cavity or the mediastinum. Any questions?
No.
Good. Do you ladies, or do you guys mind if I go to another slide?
No.
No.
Good, thank you. Now, okay, guys. So we said, okay, yes, we had pleural cavity, and okay, pleural cavity. In the middle here is okay, we have, okay, what is going to be, it's okay, the mediastinum, or we also call it, okay, the mediastinal cavity. Now, guys, comes the question is, okay, what structures do we have in the mediastinum or in the mediastinal cavity? Now, we're going to have this, okay, what we can say is, okay, the major airways. Oops. Which mainly is okay, or B is okay, the bronchus. This bronchus, yes, okay, may divide into, yes, okay, the right bronchus and left bronchus, but which means, yes, okay, as a whole can be called, yes, okay, the bronchi. So bronchus is one, bronchi is plural. We can say bronchus is singular, bronchi is plural. Clear? Which means, yes, okay, just goes to the lungs. Okay. So from bronchus or bronchi, yes, okay, come things such as bronchitis. Okay, we can say it's okay. Bronchoscope. Did that make sense?
Yeah.
Good. So that's okay. One of the main structures that we have in the abdomen is okay in the thoracic, the mediastinal cavity is going to be as okay the airways, or we can mean it's okay, say the bronchus. Now, what we also will have. Okay. Now I'm not going to go into this okay into the whole detail, but we can say it's okay major blood vessels. Now, as far as okay, these major blood vessels are concerned, as mean as okay going to be. Okay, we can just do this. They're going to be artery, and they're going to be veins. Now, as far as arteries are concerned, that's okay. That's going to be that's okay what we can call pulmonary arteries. And likewise, that's going to be okay or VS okay in the vein. We'll call this okay the pulmonary veins. Now, guys, the word pulmonary. And again, it's okay. Area in this instance, yes, okay, is our pertaining to pulmon. Which means lungs. So we made yes, okay, going to have okay pulmonary arteries, which takes blood from heart to the lung. And likewise, it's okay, pulmonary veins will bring blood back from the lungs to the heart. Okay. Other set of okay, yes, major blood vessels that we may have, not may not, will have. Is again, yes, okay, going to we can say okay, arterial and venous. Now, as far okay, the arterial major blood vessel is going to be concerned, is going to be the aorta. Whereas, okay, as the inferior, okay, as far as the venous major part of blood vessels, which are not pulmonary, is going to be as okay, respectively, as okay, what we can call as okay, the superior. Now, if you just look at the word superior, now this is going to be as okay, a positional term, which is going to be as okay, upper. And we just call it as okay, the vena cava. And the other one is going to be the inferior vena cava. But again, it says, okay, the word inferior is means, okay, again, yes, okay, that's a positional term which will mean lower or below, upper and above, lower, below. Now we can actually say that, okay, as this inferior vena cava here, that's actually, okay, come through the diaphragm from the abdomen. Okay. Now, principally, yes, okay, another structure that we have in the mediastinal cavity is going to be, yes, okay, what we call the esophagus. And what you, yes, okay, should be, yes, okay, since we, yes, okay, somehow, it's okay, already talked about, yes, okay, the word fag. Meant to swallow. So that actually is okay, going to be, it's okay, a long tubular structure that runs at the back of your thoracic cavity. Or in this case, we can say the mediastinal cavity. That is called the esophagus. And that is pretty much okay, as where food passes from your throat and actually it's okay, ends up in the stomach. So that's okay, it's okay, going to pass through, it's okay, that leftmost opening that we call the foramen hiatus. Okay, foramen is going to be Foramen, a foramen. Hiatus, Hiatus. Okay, and why I mean is okay, because what we have at the other end here is going to be okay, the stomach. Yeah. Now it's okay, out of all this, we can say it's okay, the important most organ in your mediastinum is going to be the heart. Where we say that okay, yes, the heart, the technical term for that was cardi. Okay, if we name the heart as a structure, it's going to be as okay, the cardium. Okay, what we talked about the other day, saying is okay, that the heart or the cardi or the cardium was made up of a muscle, so that's just okay, how it became the myocardium, the muscle of the heart. Is that clear?
Yeah.
Yes.
Okay, but not so quick, girls or guys, because we can say it's okay, if this is the heart, obviously as okay a layer of okay as myocardium. But your heart is going to be, yes, okay, that is going to be encircled in a two-membrane sheet called the pericardium. So the heart, that's going to be, yes, okay, encircled in what we'll call the pericardium. Where we say it's okay, the mainly is okay, just is going to be, it's okay, the suffix that makes this here is okay, the name of a structure. Cardi, we mean, yes, okay, just said was the heart. And the other day when we talked about, yes, okay, the prefix peri, we mainly said that, okay, yes, that term itself, yes, okay, meant surrounding. So the reason that there is, like I call this structure here the, let's do it this way. This structure here, the pericardium, was mainly because, okay, it was going to be, as okay, what they found surrounding the heart. Now the question is, okay, what in the is it that this pericardium here is? Well, guys, just like your pleural membrane, this is also going to be, as okay, two-layered membrane. Okay. Now, what you may see or hear me do from time to time is okay, is that okay, as this two-layered, actually, it's okay, may also be referred to as bilayered. Mainly because, okay, the term two was bi, and layered is there. Clear? Okay. So just like your pleural membrane, which was made as okay, a membrane made up of two layers. Likewise, is it that okay, your pericardium also is going to be made up of two layers. Yeah, guys, this is where you just use copy, it's okay, copy and paste, because the outer layer is going to be known as the parietal layer or parietal pericardium. Whereas, okay, as the inner layer is going to be called the visceral layer or visceral pericardium. Did that make sense? So the parietal pericardium, which was the outer layer of the pericardium, and the visceral layer of the pericardium, which was the inner layer of the pericardium, together made up, yes, okay, what we call the pericardium.
So the three of them together are the pericardium.
No.
No.
Why the three of them?
Because there's an arrow pointing at the cardium. I just grouped it in. I'm sorry.
No. Listen, my dear. The word pericardium just means surrounding the pericardium. Now just assume that, okay, as this here is the heart. Okay. Okay. If I, for instance, okay, I'm wearing a pair of gloves or mitten or whatever you want to call it, that's not going to be a part of my hand. It's separate from my hand, right? Did that make sense?
Yeah.
Okay. Okay. So your pericardium is not the part of your heart. For now, just do that. Clear? Okay. So if I put, okay, as a glove on my hand, okay, that's going to become the visceral pericardium. And if on top of that glove, it's okay, place a plastic bag or something like that, that will just become, it's okay, an outer layer, which would then be, it's okay, the parietal pericardium. Okay. So the reason that they call it a pericardium was mainly as, okay, that's the structure that surrounded the heart. Literally, it just meant the surrounding of heart. Clear? But what was it that this pericardium was? It was made up of two layers. Outer layer, the parietal, inner layer, visceral. And I already, yes, okay, show you guys the cheat one. Yes, okay, how to remember that. Visceral main, yes, okay, just closer to the organ, which in this case here is the heart. That's why they call it the visceral layer. Did that make sense? Okay, so it's two layers, okay, that surrounds the heart. Just like, okay, as for your pleura, it was two-layered membrane, an outer layer and an inner layer that surrounded the lungs. And the names are the same. The outer layer for pleura, the outer layer for, it's okay, pericardium was parietal layer. And the inner layer for pleura and the inner layer for the pericardium is the visceral layer. Did that make sense?
Yes.
Okay, good. And guys, as I said earlier, that's okay. Whenever you have membranes, and especially okay, if it's going to be a membrane that, okay, yes, may continuously move, there's going to be, it's okay, a fluid. So that's like, it's okay, we had a pleural fluid between the two layers of the pleurum. There's going to be, it's okay, a thin, clear fluid between the two layers of the pericardium, which is called nothing but the pericardial fluid. When the word pericardial just becomes, it's okay, pertaining to the pericardium. And fluid is fluid.
Wait, so that's between the visceral and the parietal?
Layers of pericardium, exactly.
Okay.
Just like here, guys, if you look here, these two layers that made up your pleural membrane, right? And it was in between, is okay, these two layers that we had the pleural fluid. Likewise, this and this made up the pericardium, which was made up of two layers, the parietal pericardium and the visceral pericardium. So in between is okay, your visceral pericardium and parietal pericardium, then we have a fluid, which is now going to be, as okay, the pericardial fluid. And deeper to that is going to be, as okay, the muscle. Or we can say, okay, the actual bulk or muscle of the heart, which is going to be, as okay, the myocardium. Did you guys get that?
Yes.
Yeah.
Right, okay. So just a little cheat to write. And we can say, okay, what did we have? We had, okay, as the pleural membrane. We have the pericardial membrane or the pericardium. Clear? Now, one cheat was that, okay, yes, they both started with P. Clear? Second thing we made is, okay, just copy and paste. As 2 layers. Where we made is, okay, just can say that, okay, yes. Outer is called parietal. And okay, yes. Inner is going to be visceral. And baby me, you can say it's okay. In between these layers here. Okay, yes, okay. Is a fluid named after the membrane, which has become, yes, okay, pleural fluid and parietal fluid, pleural fluid and pericardial fluid. Okay. So we say it's okay. The parietal. And okay, yes, and the inner side is the visceral. Okay, Singa. Did that make sense? Okay, guys. Now just take a short, should we say, it's okay, 10 minutes break, and I see you guys back at 10:20. And we will talk the abdominal pelvic cavity. Okay. Does that sound fair? Okay, good.
Yes.
Welcome back, guys. Any questions?
No.
No.
Okay. So everything clear so far?
Yes.
Okay, good. So. Oops. So we can mainly says, okay, now the next cavity that we will be talking about is going to be, it's okay. Or together call it's okay, the abdominal pelvic cavity. Is that clear?
Yes.
Now, guys, the way that I usually do it is like this. Then like this. Because what we mainly will see it, okay, that some abdominal organs or we can say, okay, organs that we find in what they call the abdominal cavity is going to continue into the pelvic cavity. Okay. Okay. So let's say, okay, now what is it that we mainly have in the abdominal cavity? Is going to, we can say, it's okay, mainly it's okay, organs of systems. Then we will have you can say things such as glands, and then we will have, okay, yes, it says, okay, major blood vessels. Now, guys, the first system that we may be taking up is going to be as, okay, the digestive system. Now, guys, for the digestive system, yes, okay, the first organ that we're going to come across in the abdominal cavity will be the stomach. Now, I hope all of you know that, okay, the word for stomach was gastro. After which is going to be as, okay, what we in common terms call as, okay, the small intestine. Where the word for the small intestine mainly as, okay, was enter. Now, guys, what you will find is that, okay, yes, the small intestine is going to, no, that's probably the wrong color to choose. Let's just choose this color. Your small intestine is going to be as, okay, divided into 3 subparts. Mainly as, okay, just running in a continuity. Okay. But it's okay, the small intestine as a whole is going to be divided into 3 parts. The first part is called the duodenum. Followed by the jejunum. Let me just, I'll try not to make this thing too clouded. Followed by the ileum. Okay, guys. So these are going to be as okay. The three parts of your small intestine. Is that clear? Is that clear?
Yes.
Yes.
Good.
Yeah.
Now from duodenum, you can say it's okay, duodenal. From jejunum, you can say jejunal. And from ileum is going to be iliac. Okay. Now we can mean it says, okay, after the small intestine, and we're just going to continue down here. Is the main is okay going to be as okay a part, which is called the cecum. C-E-C-U-M. Okay, now in America, they just spell it C-E-C-U-M. If you pick up a book written by, okay, as an English author, it's going to be C-A-E-C-U-M. And guys, attached to this cecum here is going to be as okay a small structure. Which is called the appendix. Now, guys, the reason that I don't write appendix as a part of the digestive system because it isn't. The appendix has no function related to digestion whatsoever. Okay, it is going to be as okay attached to the appendix. Oh, sorry, to the cecum. Okay, meaning it says okay, the cecum as a whole means okay, meaning it's okay, just going to be as okay this pouch-like part of your gut onto which is okay, the appendix is going to be attached like this. I mean, that's okay because it has, okay, as it looks like a worm. That's why some people may also call it as, okay, the vermiformix appendix. Okay. But the appendix, guys, is not a digestive organ. Okay. Yeah, okay, yes. For the appendix, we can say, it's okay, it will become appendicular. Is that clear?
Yes.
Good.
Yeah.
Okay. So here we can make it okay, just briefly so we know that okay, this is the appendix. Now, guys, after the appendix, okay, after the cecum comes as okay, where we in common terms can call it as okay the large intestine. Where okay as the large intestine is okay technically also could be referred to as the colon. Now when we say colon or the large intestine, guys, now this is going to just okay be divided into mainly as okay 3 parts. Or some people may even go 4. But mainly as okay, we can say okay, roughly speaking, as okay is going to be 3 parts. One is going to be as okay what we will call as okay the ascending colon. Now ascending, guys, that is mainly as okay a regular English word which mainly as okay means going up. Now this is going to as okay enter into as okay what we will call as okay the transverse colon. But the word transverse means okay just meant as we checked it. The word here means okay makes it okay as a directional term, and the word trans actually is okay meant across. So it means okay going to run across. Followed by as okay what we will call as okay the descending colon. Yeah, descending is mean as okay that's going to be as okay going down. Okay, guys. So the reason that we call it okay as respectively, because okay, we can put it this way. And say it's okay, mainly because it's okay. Down here it's okay, this was our cecum. After which is okay, the ascending colon. Mainly it's called the ascending colon because it goes up. Followed by as okay, where we become as okay, the transverse part of the colon. Mainly because it goes this way. It runs transverse or across. Followed by as okay, the descending colon. Mainly because it runs down. Did you guys get that?
Yes.
Good. Okay. Now, guys, we can mainly see as okay after this. Yes, okay, the remaining part of the digestive system. The remaining part of the digestive system. It's okay, it's going to, it's okay, continue in the pelvis. Okay. Which mainly is going to, and that's why it's okay, yes, which will become as okay, what they will call as okay, the sigmoid. Now, some people also as okay call the sigmoid. They may even as okay call it the sigmoid colon. Okay, so it's SIGMOID, sigmoid. Okay. Well, guys, okay, as I already said, okay, if you write it out big here, for instance. Sigmoid. I already, as okay, in the very beginning of the class, told you guys that okay, as the word oid. Manias, okay, was a suffix that the manias, okay, used for something that was, okay, alike. Or most likely, it's okay, you can say it's, okay, look alike. Whereas sigm, actually, it's, okay, came from the word sigma, which is the Greek or Latin for the letter S. So mainly because, okay, this part of, okay, that's what they mean. It's, okay, some people will still consider it, okay, as a part of the colon. As, okay, as this S-like shaped appearance. That's why they call it the sigmoid colon. They say, okay, it just looks like a sigma. Or what they, as, okay, in Greek will call the letter S. Or we can say, it's, okay, they're equivalent to our letter S. Did that make sense?
Yes.
Yes.
Good. Very main, yes, okay, just, okay, guys. So I'm just going to just, okay, erase a little bit of this. So that's why, okay, so that's part of, okay, yes. Oh, yes, okay, the small, this part of, okay, yes, the intestine actually got its name from, yes, okay, worded. What it looks like. Which mainly is, okay, just going to continue into okay, now that's going to go this way here, which is going to become, yes, okay, continue into, yes, okay, what we call the rectum.
This is all the pelvic cavity now, right?
Yeah.
Okay.
Okay. So yes, okay, this will be, yes, okay, in the pelvic cavity. Rectum, right, okay. Okay. After which is, okay, we will have, okay, as what we call, as, okay, the anal canal, after which it opens up through the perineum via anus. Did you guys get that?
Yes.
Okay, so you start from the beginning, yes, okay, the course of, okay, yes, the digestive organs, as, okay, structures of the digestive system that runs within the abdominal cavity is going to be the stomach, the small intestine divided into duodenum, jejunum, and ileum. First part is called the duodenum, second part the jejunum, third part the ileum. Followed by, as, okay, what we will call the cecum, followed by what we as a whole requires, okay, the large intestine or the colon, which is primarily, as, okay, divided into the ascending colon, transverse colon, descending colon, which, okay, as in the pelvis becomes, as, okay, continues as, okay, as the sigmoid colon or just the sigmoid, goes to the rectum, from rectum to anal canal, from anal canal goes up through anus. Did you guys get that?
Yes.
Good. Any questions?
No.
Good.
No.
Okay. Now, what we also said was, okay, yes, attached to the cecum was, okay, as an organ that was going to be, as, okay, what we call the appendix. Now, guys, the appendix, that's okay, that is means, okay, going to be, as, okay, you're going to be, as, okay, a part of, okay, yes, the lymphatic system. So the appendix actually is, okay, is lymphatic organ. Okay, but yes, okay, attached to the physically, yes, okay, attached to the cecum, which is okay, yes. Some people even call this as okay, I consider this as a part of the large intestine. Okay, so that's why somebody may call it okay, the cecal colon. Right, okay. Anyways. Okay, guys. Now, we can mainly say as okay, two organs, not organs, actually, it's okay, glands that are okay as found in the abdominal cavity, which is okay, we can say okay, mainly will be as okay, part of the digestive system. It's respectively as okay, going to be the liver. And okay, yes, another organ which we will call yes, okay, the pancreas. Okay. Now your liver as a whole, yes, okay, whole and soul, yes, okay, is a part of okay, the digestive system. And guys, okay, as a matter of fact, it's okay, the liver is a gland. Not just any gland, it is the largest gland of your body. Is the liver. Now the pancreas is a little bit unique because okay, it's going to be a part of the digestive system. But it's also going to, and that means it's okay, going to be a unique organ, mainly because it's also going to be as okay. An organ that is part of the endocrine system. So not only does the pancreas produces as okay, we can say as okay, digestive enzymes that play its role in okay, yes, digestion of the food. But it also is going to yes, okay, be responsible for producing different hormones. Okay, and since it also produces hormones, that's when it becomes just okay, a part of the endocrine system. Did you guys get that?
Yes.
Yes.
Okay. Good. Now, guys, we can take, okay, yes, another system. And the other system that we may, yes, okay, which structures or organs we may, yes, okay, will find in the abdominal or abdominopelvic cavity is, okay, yes, the urinary system.
So there are no major blood vessels we have to know for digestive.
Just a sec, my dear. No, not for now. Okay, not for now. If I was going to talk about that now, yes, okay. You actually is okay, striving to have okay as a final as your first question. Okay. Okay, dear.
Yes, thank you.
Okay, no problem. So mainly as okay, your urinary system. Now, my dear, yes, okay, the organs that you find in the urinary system, which falls within the limit of the abdomen. It's mainly as okay, going to be as okay, your kidneys. And from the kidneys, to mainly as okay, just have also okay, tubes, which are going to be, it's okay, the ureters. Did that make sense? Did you guys get that? Okay. And what your kidneys and ureters are going to be is okay, not the kidneys, but mainly it's okay, just the ureters are going to just okay, run all the way to yes, okay, until they become okay, reaches the pelvic cavity or enter the pelvic cavity, after which it's okay, what we mean is okay, we have as a continuity of the urinary system in the pelvic cavity is going to be as okay, the urinary bladder, which mainly is okay, just ends up or empties out via the urethra. Did you guys get that?
Yes.
Yeah.
Yes.
Okay, guys, now just to get it, we can say, okay, if this, for instance, okay, here was a kidney. Let's just say that this was a kidney. Now again, yes, okay, on top of this kidney here. On top of the kidney is going to be a gland. Yes, okay, we actually yes, okay, have a gland on top of the kidney, which is going to be as okay, an endocrine gland. And that gland is called nothing but the adrenal gland. Well, okay, guys, now here. Sorry. Right, okay. But if you look at it, well, okay, yes, one of the two words that we had for kidney was ren. The other word for kidney is okay, was nephron. Okay. Now, what they mainly is okay, just gave the name of this gland here. It's okay, it's going to be, it's okay, adrenal gland, where the word ad mainly is okay, just means close by or close to. Or next to, if you want to put it that way. So mainly because they found this right next to the kidney, they just ended up calling it okay, the adrenal. The al is just okay, our favorite suffix meaning pertaining to. Is that clear?
Yeah.
Right, okay. So it's called the adrenal gland. And this is not, there's no doubt about it. This is mainly, it's okay, endocrine gland. Okay. We will talk a little more, yes, okay, in detail about this gland here, yes, okay, when we get to the endocrine system. But since we just are at it right now, just briefly, guys, some of you may have heard of a substance. Adrenaline. Have any of you heard of that?
Yep.
Good. So what does that tell you now? That, okay, as it was primarily as, okay, produced by your adrenal gland. And you can mainly say, okay, because it ends with inner ion, it's a protein substance. Or chemically, it's okay, it is a protein. So yes, okay, on top of each kidney is it that we actually have a gland, which is going to be called the adrenal gland, which is going to be, okay, part of your endocrine system. Any questions, guys?
No.
Good. Now, most, and please mind my word, guys, I said most. Oh, wait, sorry. Let us say, okay, now somebody asked me earlier, do we need to know as, okay, the major blood vessels? Well, okay, just generally speaking, the major blood vessels that we have in the abdomen is made as we're going to be as, okay, part of the aorta, a continuation of the aorta, which means, okay, since it runs at the abdomen, it's going to become what we call the abdominal aorta. Clear? Whereas, okay, as the other major blood vessel that we have is, okay, in the abdomen is going to be as, okay, what we call, or what we earlier called as, okay, referred to as the inferior vena cava. Ish. Okay. Okay, girls.
It's just the two,
Yes.
correct?
Right now, yes.
Okay.
Okay. What branches, that's okay, the abdominal aorta here is going to, it's okay, give off. We will have a whole complete separate session just for that towards the very end of your module of anatomy and physiology. Okay. Okay, dear.
Yes, thank you.
Good. Now, why do we call aorta? Mainly because, okay, guys, it mainly is, okay, just was a continuation of the aorta, which was one of the major, okay, blood vessels that, okay, as was running in the thorax. But it continues in the abdomen and just becomes just, okay, the abdominal aorta. Where the L means, okay, just pertaining to abdomen, and, okay, the part of the aorta that runs in the abdomen. Whereas mainly as, okay, on the venous side, that's okay, what we mainly had was as a major vein. Okay, where this one has, okay, if this give off branches, this one here is going to be made up of veins that join together to make this bigger vein, which ultimately is, okay, passes on and runs into the thorax. But we can say, okay, these will be as, okay, the two major veins, blood vessels that you find in your abdominal cavity. Did you guys get that?
Yes.
Yes.
Yep. Now, what I said was, or what I will be saying now is, most, not all, right? Okay, not all, but most of your abdominal organs. Most of your abdominal organs will be covered up or completely, yes, okay, encircled in a two-layered membrane that is going to be called the peritoneum. Okay, so most of your organs in the abdomen are going to be, yes, okay, covered up in a membrane which is going to be called the peritoneum. Or we can say it's okay, it could also be called the peritoneal membrane. Now, guys, if you just look here again, it starts with a P. So what do we have now? What's going to be the next? Now I say it's okay. This is also, that's okay, going to have two layers. But again, yes, okay, the outer layer of the peritoneum is going to be the parietal peritoneum, or parietal layer. Whereas, okay, as the inner layer, which is going to, yes, okay, be right up, it's okay, across the organ that it may encircle, is going to be the visceral layer. Right, okay. And what remains is, okay, just find between these two layers of the peritoneum. It's going to be a fluid that is named after the membrane itself. So that will become, yes, okay, the peritoneal fluid. Did you guys get that?
Yes.
Okay. So, yes, okay, from time to time, yes, okay, this is an easy cheat, okay, a cheat. But the only thing you have to, yes, okay, just do is copy and paste. Okay, not all the information, but yes, okay, I told you, yes, okay, what the thing was. So yes, okay, these three, yes, okay, membranes here, they all start with the letter P, as in Peter, Patrick, or Patricia. Right? Okay, they have two layers, are constituted of two layers, where the outer layer is going to be the parietal layer, all three of them. And the visceral layer is going to be, as okay, the innermost layer of the membrane. Clear? Okay, I even show you, okay, why we call the inner layer the visceral layer, because that's going to be the layer of the membrane that is going to be right next, or yes, okay, you can say, okay, pretty much, okay, sticking on to the organ that this membrane here, okay, will be covering up. Okay, where the word visceral means, okay, just meant pertaining to organ. And in between these two layers of the membrane, of these membranes here, was a fluid which is mainly, okay, just named after the membrane. Pericardial fluid membrane, or pericardium, pericardial fluid, pleural membrane, pleural fluid, peritoneal membrane, peritoneal fluid. Did you guys get that?
Yes.
Yes.
Anybody is in the least doubt? Okay, so I hope I made that simple enough. Now, guys, when I said most, that may mean that, okay, some of your abdominal organs. Some of your abdominal organs are not going to be as okay, you can say it's okay, completely covered up in peritoneum. Right, okay, okay. And what we mainly as okay will call these organs which are as okay, we can say it's okay. We can put this okay. Okay. It's okay. The abdominal organs. Not covered in peritoneum. They're going to be referred to as being retro, which means okay, just the other day say it's okay, was behind or backward. Peritoneal. That EAL here is okay, it's just pertaining to. And peritoneum is peritoneum. Okay.
That says abdominal wall?
Abdominal organs not covered by peritoneum.
Okay.
Okay. So that means okay, going to be okay, what you can call is okay, retroperitoneal, because if it's okay, take okay as a side view of the abdominal wall, we can say okay, this side here is the front, this is the back. Okay. So we can say okay, if this is okay, oh yes, okay, we can say okay, the peritoneum runs. Organs that are not going to be completely covered up, or the structures that's not for organs. We can say okay, structures is more correct. Okay, which are not going to be completely covered up in peritoneum, are going to just okay lie behind the peritoneum. Which mainly occurs that okay, yes, it's only going to be as okay the front side or the anterior side of these structures here that will be covered up in peritoneum. May is okay because the end of is okay ending up being behind the peritoneum, or become is okay what we will call retroperitoneal. Did you guys get that?
Yes.
Right, okay. So when we go to yes, okay, to all yes, okay, abdominal, pelvic organ, or most likely yes, okay, abdominal organs. Now we can say is okay, we may have yes, okay, two kind of organs or structures. One is going to be as okay, what we'll refer to as being as okay, peritoneal, which mainly means yes, okay, that they are completely covered up in peritoneum. Okay? Did that make sense?
Yes.
Good. Whereas, okay, yes. The other would be as okay, what we just call as okay, retroperitoneal. Which means it's okay, we'll say it's okay, is not covered in peritoneum. So guys, mainly it's okay to make this here. Easy. we can mainly as okay do it this way and say as okay, whichever structures are going to be as okay peritoneal, which may mean that they are completely covered up in peritoneum. We'll underline those with dark green, and which are going to be considered as okay retroperitoneal, which mainly means okay that they are not covered up in the peritoneum completely. Actually, that's okay lies posterior to your peritoneum, and only as okay going only to be covered on the front side by peritoneum is going to be referred to as retroperitoneal. And we will underline that with yes, okay, this turquoise or light blue. So, guys, your stomach is peritoneal. Okay. Now, the reason that I do this, because it's only going to be the jejunum of your small intestine that is going to be peritoneal, and the ileum. Is that clear?
Yes.
Yes.
Good. Some of you will say, now what about the duodenal or duodenum? Now, guys, that is going to be okay a part of your small intestine. It happens to be retroperitoneal. Now, as far as okay, as your cecum is concerned, that is peritoneal. The ascending colon is peritoneal. The transverse colon is peritoneal. And we can say, okay, most of the descending colon is going to be peritoneal. So this is going to be okay 2 and 1. Okay, so the first part is going to be okay peritoneal. Last part of it is going to be retroperitoneal. Is that clear?
Yes.
Okay, guys. Now, as far as your kidneys are concerned, as far as your ureters are concerned, they are retroperitoneal. Did you guys get that?
Yeah.
Good. The liver is peritoneal. Your pancreas is retroperitoneal. The adrenal gland, which also is okay, was on top of the liver, also happens to be retroperitoneal. And your abdominal aorta itself is retroperitoneal. And the inferior vena cava is retroperitoneal. Did you guys get that?
Yeah.
Okay. Now, guys, do you mind if I go to another slide?
No.
Okay, but you can see as okay, all of your as okay pelvic organs. All of your pelvic organs mainly as okay. Well, they will, yes, okay, not be covered up in peritoneum. Mainly, it's okay, just par, it's okay, but mainly, it's okay, not specifically, yes, okay, accurately going to be referred to as okay being retroperitoneum, but only as okay, one part of the surface of them is going to, yes, okay, be covered by peritoneum, but they actually are going to lie underneath, yes, okay, the peritoneum. Now, guys, one last thing that we find in the pelvic cavity is what we can call as, okay, the reproductive system, organs of the reproductive system. Yeah, okay, guys, that's going to, yes, okay, be, that's okay. Ladies first. Sorry. And we can see it's okay, followed by men. So the reproductive organs, guys, are mainly as okay going to be in the pelvic cavity. Now we can mainly say as okay, what we have in the female reproductive system is going to primarily as okay be the uterus. We can see as okay we have what will be the vagina, which actually as okay opens up through this okay or okay. Or we can say the vaginal canal which opens up in the vagina. Okay. We have as okay the ovaries, and what the ovaries stores is going to be as okay the ovary, or what we also can call the oocytes. And then we as okay are going to have what we can call as okay the fallopian tubes. Now, guys, functionally, that's okay. There's no structure that is functionally the same as okay as what you want to call it, the uterus in the male. But okay, as something that's going to slightly equivalent, it's okay. Or we can say okay, just even it out is going to just okay be the prostate gland. Now, mainly sense, okay, as of course, as okay, man doesn't give birth. Okay. But when we talk about okay, the vagina is going to be okay, what they call is okay, organ of copulation. So the male equivalent for that is going to be as okay, the penis. Now the male equivalent for the ovaries is going to be the testes. And guys, what the testes are going to be doing is producing sperm. The women are born with the ovaries, or ova, or the eggs. They're just waiting there for their turn to get matured. And roughly speaking, not actually okay, correct. But we can say okay, an equivalent of the fallopian tube in the women, which means okay, going to be as okay, through which is okay, the ovaries, are transported from the ovaries Yes, okay, where we become the uterus. We can roughly speaking say, yes, okay, spermatic cord. Okay, although, yes, okay, not politically completely correct. Because, okay, that going to be, yes, okay, subparts of, okay, yes, the spermatic cord. Okay. Now we can mainly say, yes, okay, the floor of the pelvis, whether that's a man or a woman. That floor of the pelvis is called the perineum. Clear? Okay. In men, yes, okay. The perineum is made, yes, okay. A part of the perineum is going to be, yes, okay, forming this pouch that we call the scrotum. And it's actually, yes, okay, within this scrotum here that, okay, as we find the two testes. Now, why they need to be kept in, okay, as this pouch here, that's a whole different discussion. Okay, we will take that up when we talk the reproductive system. Okay. If I give you all the juicy details now, then what's the point? Okay. So roughly speaking, guys, that's okay. That's okay, your structures. Okay. So cardium, cardiac. Pericardium, pericardial. Pleura, pleural. Peritoneum, peritoneal. Right, okay. You can then say, okay, what do you call an inflammation of the peritoneum? Peritonitis. Now, I don't hope any of you end up suffering from that, because that can be deadly. Usually it's okay, what may cause it in most common, or mostly, unless until something else, is a ruptured appendix. Oh, that's okay, a perforated gut. Now, what caused that gut to get perforated, that's a whole different story. That can be, yes, okay, due to different reasons. Okay. But that will, yes, okay, lead to, yes, okay, what we call peritonitis, which is going to be, yes, okay, inflammation of the peritoneum. Okay. Here's again, pleuritis. Okay. So anybody are clear about the cavities? Roughly, not the exact placement, yes, okay, where the organs and so on so are. But it's okay, which organs or which systems do we have in which cavities? Right, okay. Any last word of wisdom? No. Okay, goes no, since that's okay, it is, we can say that's okay, related to yes, okay, body divisions, or yes, okay, division of the body, we can say it's okay, division of the back, or more correctly saying that's okay, division of your spine or backbone. Okay, because it's okay, your backbone or spine, or what we can call it's okay, vertebral column. It goes under yes, okay, different names. Okay, okay, can it's okay be divided into five um, 5 subsections. Right. Clear? But please, 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 please don't say Mike, but in the book it just says, okay, divisions of the back. You did not use the word division, yes, okay, back. You use vertebral column. Or you use the word vertebral column, but in the text you say it's okay, spinal column. They are the same. Is equal to the back, which is equal to this. Oh, that's okay. Not even with spinal column or vertebral column, I may just say it's okay, spine. They're all the same. Did that make sense?
Yes.
Good. Now, first of all, it's okay, why do we call it okay, the vertebral column? Maybe it's okay because it's something that goes like this. So this direction is okay. Anything is okay that goes like this is going to be a column. And guys, this is going to be rows. Did you guys know that? Okay, somebody is nodding. And those of you who are not nodding, I will assume that they will go like this. Okay. Or maybe you're just nodding because you say, okay, I got that. Okay. So, and someone say, why do we then say, okay, that the column goes like that? We'll talk about that probably as okay as, because it's okay on next component in the class or session. So yes, okay, this will be columns. This will be rows. Or if anybody have served in the army, they would know that, okay, as they say, okay, we're going to just, okay, make. Or you guys are going to just, okay, arranging, it's okay, 6 columns and 7 rows. Or whatever. And that's how it's okay to know that, okay, this is going to be, okay, the count of soldiers in that rubric area, right? Good. Okay, guys. Now, the reason that we call it vertebral, that's okay. L is, that's okay, our favorite, that's okay, pertaining to. Likewise, here is okay, spinal. But the reason that we call it a vertebral because it is made of individual bones called vertebra as one, or vertebrae if it is more than one. Okay. Now, guys, as a total, yes, okay, we have 33 vertebrae. And as I said, now, not all of them, but most of them, yes, okay, we had a vertebra above. And okay, yes, a vertebra below. They will be separated. And it's not going to be all of them. Most of them are going to be separated by what we call the intervertebral disc. Okay, we'll talk more about this intervertebral disc here. It's okay when we get to when we talk the skeletal system. But if you look at it as the word itself, the name itself for the disc is pretty much self-explanatory because it is in between two vertebrae. A vertebra above and a vertebra below. I mean, it's just in between. Okay, for something to be in between, it doesn't have to be above and below. It can even be when an object is lying in between two structures. An object which is on the right and left. Or even as front and back. As long as it runs in between, it will be as inter. And I think I saw that I said that earlier, and that was why it's because there was a term that was mean it's looking alike, may is need as a sound language was intra, where the word intra means inside. Okay, and there's a hell of a difference of being in between and inside. Okay, right now, guys, I'm sitting inside my house. So I'm intracastle. Right, okay. Whereas, if I'm standing between my house and my neighbor's house, I'm going to be as inter between my neighbor house and my house. Did that make sense? Okay, so please, 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 I love to play this game here. Okay. Okay, let's go to the division. That's most, not all. When I say most, what I mean is it's not going to be as all. So most of all areas, vertebrae are going to be separated from one another. Or what we actually find in between them is going to be what we call intervertebral disc, which is made up of cartilage. Now, guys, our vertebrae. Oh, it's or spinal column. That mainly is going to be as 5 divisions, smaller or bigger. Now, the first part is called cervical. Where we can mainly says L here is mainly as just the pertaining to. Where cervic actually that's comes from cervix. And guys, what the term cervix actually means is neck. So what we mainly can say is is the vertebrae in your neck are going to be called cervical vertebrae. Now, some of you may have heard the word cervical cancer. And you go, so is that, yes, cancer of the neck? Well, not of this neck. Let us put that straight. but it's okay, actually, it's okay, what they call is okay, the cervix of the uterus, which they call the neck of the uterus. Now, again, it's okay, that is going to be a small part of the uterus. Okay, but we can say, okay, the common side where uterine cancers develop. So that's why they just call it the cervical cancer. Clear? Okay. But when you say cervical cancer, it's not going to be as okay pertaining to this neck, but rather to the neck of the uterus. Capiche? Okay, I have a graphic representation why we may as okay refer to that as the neck, but we do that when we do the reproductive system. Yeah. So it's okay here, it's okay, cervical vertebrae. We can say it's okay, cervical vertebrae, mainly it's okay, will be because that's okay. In the cervix, where the word cervix actually is okay means neck. Now, guys, what each of these vertebrae here are going to be is okay, they're going to be represented by the letter C. Okay. And what they actually is okay will be is okay, that actually is okay, a total of 7 cervical vertebrae. So they are going to be labeled as okay, from C1 to C7. Is that clear? Okay, guys?
Yes.
So this is going to, yes, okay, whenever you see, for instance, okay, C2, that's going to refer to, yes, okay, they're talking about the second cervical vertebrae. C5, fifth cervical vertebrae. Okay, so this is mainly as okay, we can say, okay, universal way of, okay, as labeling the different cervical vertebrae. Okay, but there is a total of 7 cervical vertebrae, going from C1, C2, C3, C4, C5, C6, and C7. Now the next, and well, okay, we already, yes, okay, briefly, yes, okay, briefly already talked about that was the thoracic. But again, yes, okay, we can say, yes, okay, here is okay, it's going to be the ick. That means it's okay, the pertaining to, okay, we're going to be calling them the thoracic vertebrae, where we can mainly say, it's okay, that thorac actually, yes, okay, was derived from the word thorax. Yeah. And what you can see is okay, that in most instances, okay, when we attach it, the X is replaced with a C. Or where the word thorax actually is okay means chest. Now, guys, what these is okay, thoracic vertebrae are going to be represented with the letter C. And I already mentioned that, okay, yes, that was going to be as okay, a total of 12 thoracic vertebrae. So the actually is okay, will go from T1 to T12. Did you guys get that?
Yes.
Yes.
Any questions? Okay, so as far as the thoracic vertebrae are going to be, they're going to be numbered as T1, T2, T3, T3, T4, T5, T6, and until T12. Now, guys, the next level of our vertebral column is going to be what we'll call the lumbar vertebrae. Where again, the AR is going to be our favorite pertaining to. Whereas the lump can mean either loin, or some people may even refer to waist. But we can mean says that's going to be the part of the vertebral column that's going to be right next to your abdomen. Okay. Now the L vertebrae or the lumbar vertebrae are going to be represented by the letters L. Now they're going to go from L1 to L5. So as these are actually going to be some pretty big vertebrae that we have. But that means going to be a total of 5 vertebrae. Okay, where the number means that's going to go L1, L2, L3, L4, L5. Okay. Go. Go. Excuse me, guys. Sorry, guys. Did you guys get that?
Yes.
Okay. Now, what we mainly can say about is these is three group of vertebrae here is that they are we can say having intervertebral discs. So the vertebrae is these three groups here are going to be separated from one another by intervertebral discs. Okay, which actually also makes this this part of your spinal cord here being mobile. That it actually is can move in it. That's why it's okay. That you can it's okay. Go like this, yes. Bend over, twist to the side, etc. Mainly because of them being mobile. Now, guys, the next component of our vertebral column is going to be as okay referred to as the sacral vertebrae. Again, it's okay here the word L mean it's okay. Here's again, it's okay our pertaining to. And mainly because it's okay here, this is known as the sacrum. Which we mean is okay, just can say it's okay or be it's okay, the lower back. Now, guys, as far as okay, the sacral vertebrae are concerned, yes, okay, they are going to be labeled from S and S. And it's going to be S1 to S5. So there actually is okay were 5 sacral vertebrae. But what these were going to be, yes, okay, they are fused together into, yes, okay, a bony plate. Okay. So these 5 vertebrae here is okay. Actually, that's okay. They are 5 vertebrae, but they are fused together into, yes, okay, a bony plate. Okay. And it's going to be, yes, okay, on either side of, okay, the sacrum or the sacral vertebrae, there you actually, yes, okay, will have your pelvic bones attached. Okay. But the sacrum, as we call it, is made up of 5 sacral vertebrae fused together into a plate-like bone. Is that clear?
Yes.
So it should be counted as 5 bones, but when you look at it, it's one big bony plate. Capiche? And since they are fused together, they are going to be immobile. Okay? Or we can say it's okay, and since they are fused together, it's okay, there's going to be it's okay. It's okay. No. Oh shit. We are not going to, it's going to be as okay, no intervertebral disc between them. And that means it's okay, we'll just make them completely as okay, immobile. Okay. Now, guys, the last part of your vertebral column. That is going to be as okay, what we can call as okay, the coccygeal vertebrae. That's okay. Here's made it's okay, just your eel. That's going to be as okay, the pertaining to. Where the coccyx or coccige. Okay, you're probably running out of colors here. But we can see this here. Actually, that's okay, it comes from the word coccyx. Where yes, okay, me, yes, okay, we'll just see, yes, okay, just as we did in pharynx and larynx. Replaced in this case as okay, the G or the XR with a G. Whereas okay, in thoracic, yes, okay, the X was represented or replaced by a C. So again, guys, okay, yes. Now, what they mainly say is okay. No, it's okay. Some people may say it's okay that there's anything between it's okay 3 to 5 bones. And what they're going to be is okay, guys. These are also it's okay going to be fused together. So since they are fused together, it's okay. There's going to be it's okay no it's okay no intervertebral discs. Okay. Okay. Did you guys get that? Okay. And then some of you say, well, what the blue is that the word coccyx would mean here. In this context, that's okay is going to mean tail. Or we can mean it says okay, tailbone. So guys, and again, it's okay, I say it's okay, you may believe whatever you want to. I'm not going to just okay interfere with your faith. Okay. But what they say is okay, if we, for instance, okay, we're descendant from the apes, this is what is remaining of our tail. So right now it's okay. We can't be as okay swinging from tree to trees, right? From our tails. Or you can say it's okay using our tails because okay, we don't have much of tail left. Okay. So yes, okay, guys, this was your yes, okay, main division of your vertebral column. Right? But the main thing here is okay, mainly was okay, is for you guys to be able to just okay label the regions. So you say it's okay, cervical, thoracic, lumbar, sacral, and okay, it's coccygeal.
Coccyx is 3 to 5 bones, you said?
Yes.
Oh.
So we can just go with an intermediate number, say 4. But some people say it's 5, some people say it's 3, some people say it's 4. Okay, so there's a little bit of okay, yes. But listen, guys, okay, those are bones that are not bigger than this. Okay, you can say it's okay, the biggest of your coccygeal vertebra maybe is okay, just as big, okay, as not even as okay, the tip of your pinky, or it's okay. Clear. But hey, yeah, guys, that's a bone that hurts if you hit it. That's probably okay why they want to make sure that you are okay as secure and going on a roller coaster. Nah. There can be other issues that are going to be as okay a greater concern is okay what happens if you fly out of the seat. Okay. But it's okay if you're okay, yes, you may end up okay as hitting is okay that coccyx up against is okay the hard seat, and okay the next thing you okay you will not be able to you will be, but it's going to be as okay extremely painful, and it's one of those bones that okay if they break, yes, okay, what can you do? You can't put a plaster on, right? So it just has just okay heal by itself, which can in many cases okay become as okay a long, painful halt. Okay, guys, so what we're going to be doing when we come back is just okay, talk of our planes. So make sure that you have your tickets available so that we can go on our planes and fly. Okay. So would it be fair that I see you guys back at 12:45-ish? Or should we say 50? 50:45.
50.
50. Okay, guys. Then I see you ladies at 12:50.
Thank
Enjoy
you.
the day.
Okay,
Okay.
thanks.
Okay, take care. Make sure that you chew on your food before you faggot. Okay. Any question, guys?
Yeah, the coccygeal vertebrae represented by any letter, or no?
No.
No.
You can say C is already taken up by the cervical. Okay. Some of you would have said, then what about CX? Well, CX is the technical abbreviation of what we can call as okay chief complaints in medical history. Okay. So no, they are not represented by any letters, my dear. Now, the next thing that we will be talking about is going to be as okay, what we can call as okay. Anatomical planes. But before going to yes, okay, the anatomical plane, let's just talk about something before that. And that's going to be as okay, what we'll call as okay, the anatomical position. Okay, because guys, you can mainly says okay, all anatomy is being discussed or described. Consider the body placed in a very specific position. That is called the anatomical position. So the anatomical position mainly as okay is going to be standing straight up. So the person in this case is going to be standing up. Okay. Next component is going to be as okay looking straight ahead. So when we talk the anatomical position, not only is it good enough to say that, okay, the person is standing straight up, but he or she also gotta look straight ahead. Did that make sense?
Yes.
Now the next component is going to be, it's okay. You can say, it's okay, the arms hanging down the side. So you can say, okay, the arms are hanging down on the sides. Which mean or mean is okay, not crossed across your chest like this, not abducted like this, not raised above your head like this, or like this, or like this, or like this, or that. Clear. Your arms are going to, yes, okay, be hanging straight down by the side of the body. Did that make sense? The last but not the least. So yes, okay, the arms are hanging straight down the side, and now the palms of the hands are facing forward. So yes, okay, you or anybody standing, yes, okay, straight up, looking straight ahead. His or her arms are, yes, okay, hanging down the sides with his palms facing forward. So I mean that this becomes a thumb, index finger, middle finger, ring finger, and pinky. Okay. So guys, this is going to be, yes, okay, your anatomical position. So standing straight up, looking straight ahead, arms hanging down the side, with the palms facing forward. Okay. Anatomical position, standing straight up, looking straight ahead, arms hanging down the sides with the palms facing forward. So all anatomy that you can are going to just okay whenever we talk anatomy, you gotta consider, yes, okay, the body being in this position here. Clear. You may find somebody else, okay, lying on the side, looking in whatever crazy direction. But you still have to say, okay, well, the anatomy still is going to, yes, okay, be described as if the body was in the anatomical position. Did that make sense?
Yes.
Yes.
Okay, guys, now if you place the body in this position here, I know, yes, okay, this is not going to be a Mona Lisa, but that's not intended either. I mean, yes, okay, for this one here, it's okay. Okay, yes. He or she is okay standing straight ahead. Or staying straight ahead. Now, guys, we mainly have, yes, okay, three basic planes of the body. Now, number one, it's mainly going to be, yes, okay, what we will call, yes, okay, the sagittal plane. just so you guys know that, okay, yes. This is the right side of the body. Oh, sorry. Shit. Sorry. And okay, yes, this one here is the left side of the body. Okay. Now the sagittal plane. Now, first of all, guys, keep in mind that, okay, these sagittal planes, yes, okay, are, we can say it's okay, imaginary lines. Okay. But yes, okay, when they run along the sagittal plane, yes, okay, we can say it's okay, divides the body into, we can say it's okay, right and left side. Did you guys get that?
Yes.
Right, okay. Okay. So you can say it's okay, running in a sagittal plane. Like this. Get hold of your chainsaw. And so, okay, chainsaw is okay. If you slide somebody in this plane here is okay, that's going to be a sagittal plane. Did that make sense? Okay. Now, out of all the different, yes, okay, sagittal planes, because, yes, okay, oops, sorry, they can be, yes, okay, made at, okay, at different anatomical locations, right? Okay. But we can mainly say, okay, the sagittal plane, that's going to be, yes, okay, right in the middle. Or we can say, okay, the middle. Now, if somebody don't like the word middle, yes, okay, you can say it's okay, the central. If you don't like the word central, okay, you can say it's okay, the medial. Sagittal plane. That is going to be known as the mid-sagittal plane. Right, okay. So all, yes, okay, these sagittal planes, as okay, here they were sagittal planes, mainly because they divided the body into a smaller, bigger right and smaller and bigger left part. But the sagittal plane runs right in the middle. Bam. That sagittal plane is going to be called the mid-sagittal plane. Did you guys get that?
Yes.
Okay. Now, for instance, okay, if you slice the body like this along a sagittal plane, yes, okay, what that is going to give you, that's going to give you, yes, okay, what we call, yes, okay, a lateral view. Of your body. Now, the next one. It's going to be, yes, okay, what we will call the transverse plane. Again, yes, okay, since we say plane, there's no question about it. Yes, okay, these are going to be, well, okay, yes, imaginary lines. Of course, yes, okay, these imaginary lines are going to, yes, okay, be labeled or named in accordance to, yes, okay, the region or area, yes, okay, where they run. Okay. But these, yes, okay, when we say, yes, okay, transfer, yes, okay, that's going to, yes, okay, divide the body into an upper and lower part. So we can say, okay, a transverse plane would be something like this. Or you can even just, okay, go all the way up here, for instance. So we take any transverse plane. Let's say that we just use this one here now as a reference, okay? Bzz. What do we have above it? An upper, and what do we have below it? Is a lower part. Did you guys get that?
Yes.
Yes.
And that is mainly as, okay, now the kind of view that we may get from this can either be as, okay. But I think it's okay, the word transfers, what did the word transfers mean? If you just look at it, it meant across. So I run across from side to side. Right, okay, from side to side. So that'll make it a transverse plane. And the view that we get is, okay, from a transverse plane is going to be as, okay, what we can call as, okay, an axial view. Did you guys get that?
Yes.
Good. Now, guys, to, yes, okay, talk about, yes, okay, the sec or the last plane. We mean, yes, okay, we just need to, yes, okay, look at the body from a different angle. That's okay, or whosoever it is here is, okay, still standing in the anatomical position. Okay. Now this last plane here is, okay, is going to be referred to as the, now I can go under two names. It can be called as, okay, the frontal, or it can also be referred to as the coronal. And of course, that's okay, plane. Now, guys, again, it's okay, when we said plane, what did we mean? That, okay, this was, or these were imaginary lines. Okay. And, okay, as when these imaginary lines is, okay, run, they is, okay, they're going to divide the body into a front and back. So you can say, yes, okay, zoom, 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 when it's like this. So these are going to be, as, okay, frontal or coronal planes. Clear. And we can say, yes, okay, we just take any of these here for reference. Let's just say, yes, okay, that we use this one here. What do we have? Yes, okay, we have a front, we have a back. half or part. Clear? Now, please keep in mind, guys, that okay, the word front can also be replaced by anterior. Another word for anterior was ventral. There, okay, yes. Back could also be called posterior, which also could be called dorsal. Did you guys get that?
Yes.
So any questions? So if you take a chainsaw and go bam, 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 like this, that was made as okay, sagittal. Bam, you go like this, or this, or this, or this. That will be transverse. Whereas, okay, yes, if I move to the side and you go bam, 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 like this, that will be frontal plane or coronal planes. Did you guys get that? Good.
Yes.
Now, in your big buck book, you may see as okay, different kinds of images on page 57 and page 58 when they talk about the planes. Now, guys, let's just okay look at them together, and we say as okay, figure 2.8. Right, okay, and we go to figure 2.8, A and B. A as an apple and B as in bingo, or blue, or ball, or banana, you name it. Okay, now both of these here is okay, are just as okay examples of an regular traditional X-ray. Is that clear?
Yes.
So you can mainly say as okay, the two kind of views that you can get from an X-ray is mainly as okay going to be as okay respectively as okay, frontal or coronal view, and okay, that's what we can call it as okay, lateral or sagittal view. Is that clear?
Yes.
Good. Now beneath that is okay in the same figure, but when we say as okay, C. Now C mainly as okay is okay, just okay as a CAT scan. Now some people call it as okay a CAT scan. Some people may just call it as okay a CT scan. But what you mainly see that also like a CAT scan or a CT scan gives you is mainly as okay, just a transverse. Or the mean is okay, slides the body in a transverse section, which means okay, gives you a what they call is okay, an axial view. Okay. But of course, that's okay on a CAT scan, for instance, that's okay. Here, this is a CAT scan of your chest. The mean is okay, we'll just go and okay, as do you can say it's okay. We said, okay, CAT scan of the chest. So, okay, this is the chest. And we may, yes, okay, just going to, yes, okay, slice it at different levels. Okay, but just like, okay, as you say, yes, okay, you have a piece of bread. And okay, yes, you slide it, okay, yes, transfer axial level, yes, okay, you cut off a slice from the loaf of bread. Okay, likewise here, so it's okay, we made a slice here. And you mainly is okay, just say, well, okay. Oops, I don't know. That's the disadvantage. Just okay, now you mainly is okay. Take your slice and okay, as you look at it at this level here because the other part was separated. So that's mainly as okay, what you will see, which in this case that will be as okay, axial view. Okay, but some people as okay just call it as okay a CAT scan. Some people refer to it as a CT scan. Okay, but they can do yes okay whole body scans. Okay, if I can call it yes okay your brain, yes okay skull, and the abdomen. Whereas ladies or guys, sorry, if you go on to yes okay. So yes, okay, we can say okay, CT scan and or yes, okay, also known as a CAT scan. Now, if you go on to the next page on page 200, not 200, sorry, figure 2-9. What you mainly see as okay is 3 pictures. And okay, here they just give you as okay a picture of okay as the yes, that's okay, the brain. Okay, but these figures here, these pictures here actually as okay are examples of what we call okay as an MRI. But if you look at it, guys, okay, as MRI gives you as okay all 3 planes. It gives you as okay frontal. It gives you as okay the transverse. And it gives you yes okay that big yes okay lateral view. Okay, guys. Any questions so far?
So just to confirm, so an X-ray you can get a frontal or a sagittal, a
Mhm.
CAT scan you can get a transverse, and then an
Mhm.
MRI you can get all 3.
Yep.
Okay.
Okay. Now, guys, okay, yes. The question is because MRI is mainly as okay, just an abbreviation. So is CT scan or CAT scan also is okay, just an abbreviation. So yes, okay, what does the M, what does the R, and what does the I stands for? Now the M as in Michael stands for magnetic. The R as in raspberry stands for resonance. And I as in igloo or ice cream stands for imaging. So what they pretty much okay as use in in an MRI scan. It's actually as okay a big magnet. Okay, guys. And primarily, as okay, due to as okay, this being a big magnet, that's why as okay, you can say as okay, no earrings, no as okay, other rings wherever they are in the tongue. I'm not going to go into as okay, different kinds of okay as anatomies where people may as okay put rings, but they need to be taken out. Okay. As a matter of fact, yes, okay, even people, yes, okay, with for instance, okay, pacemakers may not be able to get okay as a what the hell you call it, as okay, an MRI done. Because okay, components of this pacemaker here are metallic, which is going to say okay. We can say it's okay, get affected by the strong magnet. Did that make sense?
Yes.
Even people, yes, okay, where you can say it's okay, artificial heart valves and so on. So where part of it, yes, okay, will be metallic. Well, okay, yes, may not be as okay. You can say unable to get a MRI. Well, you can still do it, but the thing is that okay, yes, the image is all going to be like okay. Have you guys ever turned on the TV when okay, it's okay if the cable is not out? It's okay, you're not receiving any signal on the cable. You just see all those small sparks all over the place. That's what it's going to be looking like. So you don't really get any image. Even if you do, yes, okay, it's going to be it's okay, extremely affected by the strong magnet. Not to talk about yes, okay, that magnet, yes, okay, may actually yes, okay, physically destroy the metal itself. On a worst case, and that's well, okay, a story, not a story like a fairy tale, and it doesn't have a happy ending either. But an incident in a TV program where okay, as it was primarily as okay, a dentist who were talking about things such as tongue piercings and things like that. People try to just okay tend to play with it, and okay, eventually it's okay, it destroys your teeth. Okay, wear them down. But the next thing was that okay, yes, this person, yes, okay, young girl had not told the staff that she had a tongue piercing, and they put her through that MRI. And what was happening next? Now this is high energy, it's high energetic, yes, okay. That actually is okay, made that tongue piercing or whatever she had put in the tongue start becoming glowing hot and pretty much okay, deep fried her tongue. So yes. Guys, even things such as credit cards and things like that, don't bring that close to an MRI machine. I know that the hard way. I learned that the hard way. And that's okay. Luckily, not my credit card because I will not take my credit cards or bank card with me to work. When I'm going to work, I didn't have time to go to the bank. Let me be honest about that. So maybe it's okay, just leave that at home. But my employee card had a magnetic strip. And what would I use that for? As okay, mainly as okay to access okay as any place in the hospital, maybe just swipe, and okay the doors were open for me. Now it had happened that okay I had to be as okay a part of okay as moving a patient from the stretcher or couch onto the machine, wearing that employee ID. At that point, I was not thinking about it. Sometimes you don't think that can happen for everybody. So that's okay. That the magnet of the machine actually is okay, dragged onto my employee ID, but I was able to just okay pull it off anyways. Didn't think about it until later that night. And like my apartment pretty much okay was okay as at a stone throws distance from the hospital. I mean it's like it was living on campus. So what you can say, they called me, it's okay, shit o'clock in the night, I say, okay, do you mind coming and look at this patient? I said, okay, I'll be there. Now mainly it's okay, the back doors it's okay, where I were able to it's okay, go in through. I was just swipe my card and okay, boom, the door were open. I swiped and I swiped and I swiped and I swiped, nothing happened. And eventually it's okay, I had to, it's okay, press the button and the guy at the security is okay. I got in touch with him. I said, I'm standing by this door, I can't get in. So he said, okay, probably your card is not working. So anyway, he pressed the button, the door opened. And he said, just come by, I issue you, okay, a temporary card. So you can, I mean, yes, okay, just have access until you make a new one in the morning. But that was pretty much okay as the magnetic strip of my employee ID card was actually okay by the magnetic field of the MRI. Did that make sense? So yes, okay. So it's okay. MRI stands for magnetic resonance imaging. Now you may say yes, okay, CT. Now somebody will just okay say, yeah, Mike, that makes Connecticut. But my guy, dear guys, in CT, yes, okay, the word or the letter C. And then we can just okay say T. The C actually is okay means computed. And T chomo, which means okay is from chomi, which is cutting into. But yes, okay, we don't physically okay cut into somebody graphy. When I say graphy, yes, okay, does that become the process? When you just say graph, it's just going to be as okay the picture of the image itself. Clear?
Yes.
Yes, okay, if somebody like to call it, yes, okay, CAT scan. Well, okay, the C is still computed. The T is still tomography. And the A is mainly just okay, just the axial. Any questions, guys?
No.
Good. Now I see most of you have pets. Have any of you ever had a hamster?
Yeah,
Okay. You had a hamster?
yeah,
Good. Is it still around?
no,
No. Okay. It died, right?
yep,
Yeah, they don't live that long. That's okay. So, guys, don't buy them. Because they're small, they're cute, they're funny to look at. You get attached to them, and when they die, it's okay. It's going to be it's okay. Cheers, cheers, cheers. Right, Caitlin?
yeah, a lot of tears.
A lot of tears. Good. So a guy wanted to just okay save himself from the tears. So what did he do? He found the hamster, yes, okay, non-responsive. He took it to the vet. and say, okay, maybe I can just okay buy myself just okay freedom from cheaters. And he said, well, I found my hamster. It looks like okay, it's dead. But since you're the vet, could you confirm it is dead? And the vet he made us okay, just flip the hamster us okay up and down, back and forward. And he go, yeah, it looks pretty dead to me. Now he issued the guy a bill, $400, confirmation of okay, yes, the hamster being dead. But I guess this guy was willing to pay anything just to see us okay, we're Australia's okay, 1% alive. So he said, "No, I'm still not satisfied. Do you mind? Do you mind do some further checking on it to make sure that it is dead?" And he goes, "Sure, why not?" So just sit in the next room, and I just go, "Yes, okay, do some more testing." So he puts this hamster on a desk, open the door, kiss kiss, calls in the cat. The cat walks in, circles around his dead hamster, flips it back and forth with his palm a couple of times, and walks out. Then the vet opened another door. And in comes his Labrador. Sniffs on this dead hamster, looked at it, sniffed at it again, didn't pay much attention, didn't bark, didn't do anything, just walked out. Now the vet was making a bill. So yes, okay, those $400 in the first time, yes, okay, they were still there. Confirmation of that hamster, $400. Now the next thing that he added on to it was a CAT scan, $1,000. Lab test. Now usually when says you go to the lab and okay, yes, give a specimen of something, blood, urine, sputum, you call it feces. Here, just because you had to have a Labrador in the next room that could come in and that became the lab test. $600. So that's okay. A $400 bill became $2,000. Right? Okay. So yeah. If it doesn't respond, even if you bring a cat, or even if you bring somebody's neighbor's Labrador in, a dead hamster is not going to respond. Okay. So yes, okay, that's your CAT scan. That's why I don't like it. I just call it a CT scan because then you don't have any confusion with the animals. Okay, guys. Now, so, well, okay, as if there's a scan that is called a CAT scan, but we mean it's okay, just use this dude. Have some of you heard of okay what they call a PET scan? And you may say, okay, that's probably just okay going to be as okay walking that hamster through as okay a zoo or a pet store. Have any of you heard of PET scan?
Yeah,
Okay, you know what the PET stands for?
no.
Yeah, okay. Okay. PET is okay, no, it's not the PET. It's me, it's okay, just an abbreviation, but it's okay. People like just okay pronounce abbreviations. So that's okay. PET is positron. E emission. And the T is again is okay tomography. Okay, but guys, this test here as well is going to is okay be just like okay the CAT scan or CT scan. Sorry, very 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 high in radiations. Okay, so it's not a test that they as okay just we do or just will do just for doing it. Okay, it's most likely in most instances okay going to be okay a whole body scan, and the main is okay do that in cases of okay as cancer patients. Main is as okay to see where the cancer might have spread to. So mainly is okay, what that will do is okay, those areas where the cancer has spread to is okay, will show up as darker lesions on the scan. Is that clear? Now, guys, well, okay, the program that you guys have signed up to. First of all, as okay, is very safe. Ultrasound, pretty safe. That's why it's okay. So far, it's okay. There has been no contraindication why we can't do it on pregnant ladies. You go X-ray, you have to think twice. You go CAT scan, you have to think 20 times. PET scans and things like that is complete as okay out of question. Right? Okay. So what are going to be as okay the views that you guys will be able to get? Or how are they labeled or named? Now the main is okay, just two kind of views that you guys will be doing. Okay. And they are going to be what we call sagittal, and that is going to be as okay transverse. Okay, but again, we can say it's okay. You know, this was the person. And it really doesn't matter. But if we can say it's okay now, in all this is okay, we can say it's okay. This, for instance, is okay. This is your scanner that you use. Oh, it's okay. Technically, it's okay. We will call that fellow the transducer. Okay. But we can mainly say, okay, let's do it this way and say it's okay. If this is 1 and this is 2. Now, if you hold the transducer, that we can say it's okay, like this. At any area, it doesn't really matter. Where, okay, yes. 1 will be here, 2 will be here, 1 will be here, 2 will be here, and so on. That is us getting us okay. Getting a sagittal view. Mainly because okay, the transducer is held or placed as okay along the sagittal plane. Did that make sense?
Yes.
Right, okay. Whereas if you place your transducer like this at any area, right? Okay, it can be like okay, this, any area. Or where you mainly will say it's okay. This is 1. Oh, let's do this. This is 1, and this is 2. This is 1, this is 2. That's going to be okay. What we call is okay, transverse view. So your views on ultrasound are mainly as okay, just going to be in accordance to as okay how you place your transducer when you scan. Okay. Did that make sense?
Yes.
Any questions? Okay, so there are going to as okay be regions that they will say as okay, what you need to do is, well, okay, you need to take a sagittal view, but you also need to take a transverse view in the same area. Clear? So that's okay. In that instance, okay, it's just going to be as okay in accordance to as okay the relation, yes, okay, and the position in which yes, okay, the transducer is placed or held. Have any of you ever seen an ultrasound transducer?
Yeah.
Yep.
Okay. If not, you can always say, okay, why should I ask you to do that on your own? You can just show here. Let's see. No, I don't have. Okay. Now maybe help. Let me have that on my computer here still. Yes. No. Yeah. Yeah, I know. Okay, guys, here we go. You guys can see this fellow here?
Yes.
Right. Okay, so this one here is okay. If you put it like this is going to just okay be it says okay, I mean it's okay a sagittal view. Okay, because it says okay, this one here was 1, and this one was 2. Whereas okay, if you flip it, where 1 would be here and 2 would be here, you can mean it says okay, then your transducer would have been something like this, right? Right, okay. And then that now becomes, so okay, 1 is here and 2 is here, but that's going to be transverse. So this here is sagittal. That's how you scan in different planes. Okay, but we talk more about that when we get to, no. We'll talk more about that when we go to our ultrasound physics. Okay, guys. So, okay, let me just take you guys to table 2.1. Do you have your books on you?
Yeah.
Okay, and you can say table 2.1. This is probably as okay one of the main things. You're probably not going to just okay be free from that for as long as you are scanning. Table 2.1. Somebody has lost. It is in chapter 2. Positional and directional terms. Okay. Now, first is anterior. Now, ante was before or ahead or front. Clear? So just think of something as, okay, which is in front. Now here is, okay, although the word is not written, but you can still write the word ventral, V-E-N-T-R-E-L, along with anterior, because that's just an alternative for anterior. Somebody who wants to be as, okay, pain in the, may as, okay, put the word ventral on a test, and you go like, oh, what the, what that was. So here is, okay, I told you. Okay, posterior. Now, posterior, it says, okay, comes from the word post, which is after. I says, okay, post-traumatic stress syndrome, or stress disorder, right? Okay, postpartum depression, or postpartum depression, depression after giving birth, after delivery of a baby. Okay, so it comes after, it doesn't come before. Okay, so, but another word for posterior was dorsal. So write that down as well. So right next to posterior, write the word dorsal. D-O-R-S-A-L. Clear? Superior. The next one is inferior. Now, guys, okay, I want you to do this. Because again, it's okay, we take the body. We take the body. Now, guys, usually it's okay, we say inferior. Is going to mean in this direction. Okay. Now, guys, when we, yes, okay, you talk, yes, okay, take this term, yes, okay, we use the term inferior, but in context to, yes, okay, to your central torso. The term that may also, yes, okay, have the same meaning as inferior is going to be caudal, C-A-U-D-A-L. Again, yes, okay, the L here is just as okay, pertaining to. And the cauda. It's tail. Okay. Clear? So you can mean it as, okay, the word caudal will just mean it's okay towards the tail. Clear? In some cases, okay, they may also, yes, okay, use the word infra as a substitute to inferior. Is that clear?
Yes.
Okay. Whereas, okay, guys, if we go in the opposite direction, now your book says superior. Now, strange is okay, likewise, okay, you can use superior. You can also say, okay, supra. Okay. Now here, you can say as, okay, in this direction. So yes, okay, another word for superior can also be cephalic. Right, okay. The whole day is okay, the word cephalic means okay, just meant pertaining to the head. By head, okay, we use it as a directional term. That's okay, it's going to be pertaining towards the head. Okay. They may also, as okay, here, is okay, use the word pelvic, which although it's okay, just means okay, pertaining to the pelvis. But if you use it as a directional term, it can also be as okay, towards the pelvis. There here is okay, you can also use the word cranial, which means okay, what does mean is okay, towards the cranium or skull. Did that make sense?
Yes.
Good. Okay, now this guy here is okay, he or she is standing in the anatomical position. So the next term that we will talk of is going to be as okay, what we can call lateral. Or the opposite of lateral, guys, is just going to be medial. So we says okay, in terms of lateral as okay, as a positional or directional term, is going to be towards the sides. Whereas medial, as I said earlier, now L here is okay, just as okay, you're pertaining to, but the word media, just like social media, is going to mean towards the middle. Did you guys get that?
Yes.
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 Okay. So if you just look at it, you can take an example and say, that's okay. The nose is medial to your eyes. But you can just go in the opposite and say, that's okay, the eyes are lateral to the ear, to the nose. Now the eyes are going to be medial to the ears, where the ears are going to be lateral to the eyes. Not to talk about the nose. So mainly as okay, if you go in this direction, as okay, that's going to be lateral, whereas if you go like this, that's going to be medial. So this is lateral, this is medial. Did that make sense? So just as I said the other day, is okay, somebody asks you, somebody else, okay, where are you living? And he says, like, in front of 7-Eleven. Where's 7-Eleven? Was in front of my house. So these are going to just okay be relational terms. She says, okay, I go immediately from what? From the stomach, from so and so, from this structure and so and so. What do you come across? And go immediately is okay, it's going to be this. But it's okay if you start from any of those points and go laterally, it's okay, what is that you come across? That's pretty much okay as what all anatomy is about. You start from a higher point and go down. It means, okay, if this was my starting point, it's okay. Any structure below this point is going to be inferior to this. There's any structure which will start from here and go up, any structure beyond this point here is going to be superior to this point here. Did that make sense? Okay,
Yeah.
good. Okay, guys. Now the next two terms, whether that is, okay, let's do it this way. Proximal versus distal. Okay. Now these two terms here, my guys, are mainly as okay, primarily as okay, used for your limbs, which would be as okay, your arms and legs. Where the verb proximal mainly as okay or mean as okay, close to. And distal will mainly as okay, mean far away from. Okay. Now when we use as okay the verb proximal, well, let's say it's okay, our upper limb or arm. You can say it's okay, the shoulder is proximal to yes, okay, let's say it's okay, the elbow. But you mean you can say that okay, that line is okay, just makes the elbow distal to the shoulder. Or vice versa. Now you can then say as okay that the elbow, well, okay, of course that's okay, that's going to be as okay, be proximal to the wrist, where there's going to be the wrist, there is going to be as okay, distal to the elbow, not to talk about as okay, being distal to the shoulder. Right, okay. So mainly as okay, what I will use to say is okay, any point on your limbs, arms and legs, that refers to as okay, a point that is closer to where it's okay, where they are attached, is going to be proximal. Where anything which is farther away from is okay, where it's going to be attached to the body is going to be distal. Clear? Now a cheat that I used some 30 years ago when I was taught these words in first year in med school. I talk of distal in terms of distant. Distant, something which is far away, right? So that was my cheat back then. Just to remember, yes, okay, what distant means. But you can go proxima, yes, okay. You call somebody, yes, okay, to get some work done at your house. You want to say, okay, I want to paint my room. It's okay, give me a close estimate. Now, why do you call it a close estimate? Because you don't want to, okay, yes, you do the job and all of a sudden, just okay, he or she gives you just okay a bill which is 2,000 more than okay as the estimate, right? Yeah, close estimate, okay, there should be a margin, okay, $200 plus minus. So that's going to yes, okay, you can call as okay, then a close estimate or an approximately. Now, where did that approximately come from? Close to what is going to be as okay, my bill looking like. Okay, so you don't come yes, okay, so you didn't wake up for a big surprise. You thought that okay, the room was going to be painted in $200, but they painted it as okay, $2,400 for you. Okay, guys. I see you guys back tomorrow. Now, so okay, before you leave, just be aware. Chapter 1 and chapter 2 will be on your quiz.
It's just chapter 1 and 2, right?
Yes.
Okay.
So if you pay a little bit attention to just okay, what I've been talking about, you should be more than good.
And it's
Okay.
at 9 a.m., right, on campus?
Well, okay, yes. Yeah, just meet up at 9 a.m. and we'll take it from there.
Okay, and we're staying after we're done to have class?
Yeah.
Okay.
You'll be staying afterwards. Well, okay, even if it was twice the amount of students, I'll still be as okay, grade the tests, call you guys in. Since I have you guys there, you get your question paper, you get your answer sheets. It's okay, we'll go over each question and say, okay, why is it that your answers were wrong? Because you chose an option because you thought that was the right answer. Okay, so and after that, well, okay, yes, then we will see, okay, what happens then. Okay, but it's okay, for your quiz is chapter 1 and chapter 2. So tomorrow, that's okay. Most of the things you already talked about, but we can just okay, slowly try to okay, go over them. Okay, guys. Any last words? Enjoy the sun. Okay, guys, have fun.
Thank you.
You.